There are a lot of people out there who disagree with that point of view. Some of them believe that the vaccines are in some way harmful. The science, as you say, is pretty clear that that's not the case. There are others who say, for some reason, that this should be an individual choice, that we should just allow parents and doctors to make this decision on their own. What do you say to those people who have this view that the government, there should be no mandates of any kind, government should never be involved in this?
Well, I would agree with them that it was an individual choice if they were the only ones being affected. But recognize we're all in this together. Our children are in this together. We don't live in isolation. So your decision does not affect only you. It's sort of like secondhand smoking. Yeah, you don't get to say, well, it's only affecting me. It doesn't affect all these other people around me. That's a very selfish attitude to have.
So Senator Paul today has now issued a statement twice in a row. Yesterday and then today, he's issued basically the same statement, where he said that vaccines should be voluntary and, like most medical decisions, between doctor and patient, not the government. I think if I'm hearing you right, what you said a second ago is, if you're hearing what he's just said and hear what you just said, you would say that that view is a selfish point of view on his part.
I don't want to necessarily talk about what he said, to be honest with you, because I'm sure if you had an in-depth conversation with him, you'd come away with a very different impression. Because he's actually a very reasonable person. Well, but the fact of the matter is,
Dr. Carson,
we have to understand that there is public policy and there is health policy that we have to pay attention to.
Dr. Carson, I'm not trying to create a fight between you and Rand Paul, but I got to say, this is the second time today you've suggested that if one understood his views in full, one would come away with a different impression. He's done several interviews on that. He has, as some have said, doubled down on this notion that this is an individual choice and that there are medical risks that if parents think outweigh the benefits of getting vaccination for their kids, they shouldn't do it. So you said today that if someone had that view, it would be callous and not taking into account public safety. That seems to be his position. Are you still saying, despite his clear enunciation of his views, that he's being misunderstood and he agrees with you?
I would ask him that question directly and see what he has to say.
Well, but you've said to us and earlier today that he's misunderstood. I'll just give you the choice again. Are you saying that if one understood his views, he would agree with you, or are you saying that his position is callous? Seems to me it's one or the other.
No, it's not one or the other. I'm saying that there's no need for us to sit there and judge what he's saying without actually sitting him down and asking him, do you believe that it is a selfish thing for someone not to vaccinate themselves and expose others to the risk of disease? And as a physician, see what he has to say.
Dr. Carson, you're a physician and he's a physician. I'll give you another quote of his today. It seems pretty clearly in context. He says, I've heard of many tragic cases of walking, talking, normal children who wound up with profound mental disorders after vaccines. I just want to ask you as a medical professional whether you think that there's any basis for that statement.
There have been many stories like that have circulated. Have I ever encountered one? No.
So is there a medical basis for his statement?
I think there probably are people who may make a correlation where one does not exist, and then that sort of ignites and catches fire and spreads, and that's probably the source of those things. I am not aware of scientific evidence.
Right.
Of a direct correlation.
So it's one thing for a talk radio host or a politician who doesn't have a medical degree to say those things. But I just wonder, as a doctor, whether you're troubled that amongst those who's saying this is Senator Paul, who is a doctor.
Well, he's retired, I believe, as a physician. But you know, everybody is entitled to their opinion.
But not to their own facts.
The important thing is for us. The important thing is for us to make sure that the populace understands that there is no substantial risk and that the benefits are extremely significant.
So
and that we've eradicated.
You'd say in your stance that everyone's entitled to their opinion, that if a medical doctor goes around saying in a public way vaccines are dangerous and it should be up to the parents, not public policy. You're fine with that. You just chalk that up to somebody else's opinion, even if they're a doctor?
Even doctors are entitled to their opinions, but I say ask him those direct questions and see what he has to say.